Dear viewers, welcome. Today, we are here to emphasize the importance of our lungs, one of the cornerstones of our health, and how critical it is to protect them. Our lungs are vital organs at the center of our respiratory system, providing our bodies with essential oxygen every time we breathe. However, various factors can affect this process and seriously impact our lung health. That's why today, we will delve into these factors in detail. Awareness of the factors that can affect lung health is crucial for maintaining a healthy lifestyle. Many factors such as environmental factors, lifestyle choices, and genetic factors can influence our lungs positively or negatively. Therefore, by examining some of these factors today, we will learn what we can do for a healthy respiratory system. Making conscious choices to protect and improve our lung health is of critical importance for our long-term health and well-being. Whether by reviewing our lifestyle, improving environmental conditions, or through regular health checkups, we can take a variety of steps to protect our lung health. These steps can have positive effects in all aspects of our lives and help us lead a happier, more active life with a healthy respiratory system. Therefore, as we address this important topic together, our goal is to develop a conscious approach to understanding and protecting lung health. Together, we will be inspired to learn and implement the necessary steps for a healthy respiratory system. Now, let's take a look at the variety of factors that affect lung health and explore what we can do for a healthy life. Smoking, the most significant threat to lung health. Smoking is not only a serious public health issue affecting an individual's health but also negatively impacts the health of those around them. Cigarette smoke contains thousands of chemicals, many of which are extremely harmful to lung health. Nicotine, carbon monoxide, tar, arsenic, and many other harmful substances in cigarettes damage the lungs of smokers. One of the most common lung diseases among smokers is lung cancer. Smoking increases the risk of developing lung cancer and is responsible for a significant portion of lung cancer cases worldwide. Additionally, smoking can lead to respiratory diseases such as chronic obstructive pulmonary disease, COPD, bronchitis, and emphysema. Symptoms of these diseases include coughing, shortness of breath, wheezing, and phlegm production. Conditions like COPD can significantly reduce quality of life and pose life-threatening risks. Smoking also adversely affects lung function. Cigarette smoke destroys the air sacs, alveoli, in the lungs and hinders the exchange of oxygen and carbon dioxide, increasing the risk of respiratory failure and causing difficulty in daily activities. Smoking not only harms the lungs but also damages the cardiovascular system. It narrows blood vessels and increases blood pressure, thus raising the risk of heart attacks and strokes. Despite these harmful effects, quitting smoking is possible and one of the most effective ways to improve lung health. Quitting smoking can help the lungs heal and improve respiratory function. Moreover, quitting smoking enhances cardiovascular health and overall quality of life. In conclusion, smoking is one of the most significant factors negatively impacting lung health and can lead to serious health issues. Quitting smoking is one of the most crucial steps that can be taken to protect lung health and lead a longer and healthier life. Air pollution, the invisible enemy threatening lung health. Air pollution emerges as a significant health issue worldwide today. Pollutants originating from various sources such as industrial activities, vehicle exhausts, agricultural pesticides, and burning residues accumulate in the atmosphere and can harm our lungs through the air we breathe. Air pollution is particularly prevalent in large cities and industrial areas but can also be a concern in rural areas. When we breathe in polluted air, harmful particles reach our lungs. These particles can vary in size and penetrate deep into the lungs through deep breathing. Especially fine particles known as PM2.5 and PM10 can infiltrate lung tissue and adversely affect lung function. Air pollution can negatively impact lung health and lead to various respiratory diseases. Diseases such as asthma, bronchitis, COPD, and lung cancer are particularly associated with factors stemming from air pollution. Inhaling polluted air can cause inflammation and irritation in the lungs, triggering respiratory problems and worsening symptoms. Air pollution poses a greater risk, especially for children, the elderly, and those with chronic respiratory diseases. Children, whose lungs are not yet fully developed, are more susceptible to air pollution and are more prone to long-term health issues. The elderly and individuals with chronic respiratory diseases are more affected by air pollution due to already compromised lung function, exacerbating their symptoms. One of the best ways to protect against air pollution is to avoid breathing polluted air. This may involve measures such as using filtered masks to protect respiratory pathways or improving indoor air quality. Additionally, reducing the use of fossil fuels, controlling vehicle emissions, and minimizing industrial waste are crucial in reducing air pollution. Air pollution is a significant factor negatively impacting lung health, leading to an increase in respiratory diseases and worsening symptoms. Therefore, measures need to be taken at individual and societal levels to protect against air pollution. Passive smoking. The invisible danger of cigarettes. Passive smoking is a health risk faced by individuals who are exposed to cigarette smoke but do not actively smoke themselves. The thousands of chemicals found in cigarette smoke can significantly impact the health of both smokers and those around them. Particularly, smoking indoors or being in environments where smoking occurs increases the risk of exposure to passive smoking. Passive smoking can seriously affect lung health and lead to various respiratory diseases. Chemicals in cigarette smoke reach the lungs through inhalation and damage lung tissue, resulting in impaired lung function and respiratory problems. Children, pregnant women, the elderly, and individuals with chronic respiratory diseases are particularly sensitive to the harmful effects of passive smoking. Children, whose lungs are not yet fully developed, can suffer long-term health problems from exposure to cigarette smoke. Pregnant women can negatively affect their baby's health by being exposed to cigarette smoke. The elderly and individuals with chronic respiratory diseases may feel the harmful effects of passive smoking more acutely due to already compromised lung function. One of the best ways to protect against exposure to passive smoking is to avoid environments where smoking occurs. Choosing outdoor areas with lower risks of smoke spread over indoor areas where smoking is prevalent can reduce the risk of passive smoking. Additionally, limiting contact with smokers and avoiding spending time in environments where smoking occurs can be important ways to protect against passive smoking. Passive smoking is a serious issue that not only affects smokers but also the health of those around them. Avoiding exposure to cigarette smoke is important for protecting lung health and reducing the risk of respiratory diseases. Alcohol and drug use. Their effects and risks on lung health. Alcohol and drug use not only lead to addiction and social problems but can also significantly impact lung health. Besides their effects on the brain and body, alcohol can also adversely affect lung function. Excessive alcohol consumption can cause inflammation in the lungs and damage lung tissue. This can impair respiratory function and increase the risk of respiratory diseases. Drug use can also negatively affect lung health. Particularly, substances like tobacco and marijuana when used in smoking forms can harm the lungs and increase the risk of respiratory diseases. Tobacco smoke can cause damage to lung tissue and increase the risk of lung cancer. It's known that chemicals in marijuana can damage the lungs and lead to respiratory diseases. The effects of drug use on lung health can manifest with symptoms such as coughing, phlegm production, and shortness of breath, which can indicate respiratory issues. Additionally, chronic drug use can impair lung function and increase the risk of lung diseases. The best way to minimize the effects of alcohol and drug use on lung health is to abstain from these substances. Adopting a healthy lifestyle, engaging in regular exercise, and maintaining a balanced diet are crucial for preserving lung health. Furthermore, it's essential for individuals struggling with alcohol and drug addiction to seek support by participating in treatment and rehabilitation programs. Alcohol and drug use are significant factors negatively impacting lung health. Avoiding these substances and adopting healthy lifestyle habits are essential for preserving lung health and reducing the risk of respiratory diseases. Working with hazardous chemicals, a dangerous risk threatening respiratory health. In some professions, exposure to hazardous chemicals may be unavoidable. Many occupations such as construction workers, chemists, cleaners, and agricultural workers may require working with various harmful chemicals. Many of these chemicals, when inhaled through the respiratory system, can significantly impact lung health and lead to respiratory diseases. Exposure to chemicals can cause inflammation, irritation, and damage to the lungs. Prolonged exposure to chemicals can impair lung function and lead to respiratory problems. Additionally, some chemicals can increase the risk of lung cancer and exacerbate symptoms of respiratory diseases. Using personal protective equipment when working with chemicals is crucial for preserving respiratory health. Respiratory masks, vapor masks, eye protection, and appropriate gloves can prevent exposure to chemicals and reduce the risk of respiratory diseases. Furthermore, working in well-ventilated areas when dealing with chemicals is important. A well-ventilated work environment prevents the accumulation of harmful vapors and preserves respiratory health. Additionally, immediate cleanup of chemical spills and maintaining personal hygiene are essential. Adhering to chemical safety protocols by both colleagues and employers is a significant way to minimize chemical exposure in the workplace. Paying attention to safety procedures when working with chemicals is vital for preserving respiratory health. In conclusion, working with hazardous chemicals poses a significant risk factor for respiratory health. Using personal protective equipment, working in well-ventilated environments, and adhering to safety protocols are important for reducing the risk of respiratory diseases. Harmful particles, the hidden danger in the air we breathe. Dust, smoke, pollen, and other harmful particles can be present in the air we breathe and can significantly impact lung health. Particularly, industrial activities, traffic emissions, agricultural operations, and burning residues can lead to the accumulation of harmful particles in the atmosphere. Fine particles, known as PM2.5 and PM10, can harm our lungs and increase the risk of developing respiratory diseases. These particles can reach the deepest regions of our lungs through deep inhalation and cause inflammation and irritation in lung tissue. Exposure to harmful particles can worsen symptoms of respiratory diseases, especially asthma, COPD, bronchitis, and lung cancer. Moreover, prolonged exposure can cause permanent damage to lung function and significantly reduce quality of life. One of the best ways to protect against exposure to harmful particles is to improve the air quality we breathe. Various measures can be taken, such as controlling industrial emissions, reducing traffic congestion, and limiting burning activities. Additionally, the use of personal protective equipment like filtered respiratory masks can provide protection against harmful particles. Chronic stress, the unseen threat to your lung health. Chronic stress has become an inevitable part of modern life and can have numerous negative effects on health. Stress manifests as a response of the body and can cause physical and emotional discomfort. Chronic stress can weaken your body's immune system and lead to various health problems, including lung health. The effects of stress on lung health can occur by affecting the functioning of the respiratory system. Chronic stress can lead to the tightening of muscles in the respiratory tract, which can hinder deep breathing and the opening of airways. This can make the process of breathing more difficult and lead to respiratory problems. Moreover, it is known that chronic stress can increase inflammatory responses in the body, which can lead to inflammation in the lungs. This can increase the risk of developing respiratory diseases and worsen the symptoms of asthma, COPD, and other respiratory conditions. Chronic stress can also lead to the emergence of unhealthy behaviors such as smoking. People under stress may turn to smoking or other harmful habits like alcohol and drug use as coping mechanisms. This can further negatively impact lung health and increase the risk of respiratory diseases. There are many strategies to cope with chronic stress, including engaging in regular exercise, practicing deep breathing and relaxation techniques, maintaining a healthy diet, and building a social support network. Learning and implementing ways to cope with stress are important for preserving lung health and reducing the risk of respiratory diseases. Chronic stress can negatively affect lung health and increase the risk of developing respiratory diseases. Developing and implementing stress management strategies are important for preserving lung health and leading a healthy life. Obesity, the unseen risk factor threatening your lung health. Obesity is an increasingly prevalent health issue worldwide and is associated with many chronic diseases. However, the effects of obesity on lung health are often overlooked. Obesity can have a range of negative effects on the respiratory system and increase the risk of respiratory problems. The effects of obesity on lung health stem from the complex relationship between body weight and respiratory function. Obesity can lead to the expansion of the chest cavity and compression of the lungs, making breathing difficult and increasing the risk of respiratory problems. Additionally, obesity can increase inflammation in the body, leading to inflammation in the lungs and tissue damage. Obesity can also increase the risk of developing respiratory conditions such as sleep apnea. Sleep apnea is a condition characterized by repeated pauses in breathing during sleep and can adversely affect lung function due to obstruction of the airways. The best way to minimize the effects of obesity on lung health is to adopt a healthy lifestyle. Engaging in regular exercise alongside a balanced diet is an effective way to maintain weight control and prevent obesity. Additionally, managing obesity is possible by participating in a healthy weight loss program and seeking support from expert healthcare professionals. Understanding the effects of obesity on lung health, adopting healthy lifestyle habits, and minimizing the negative effects of obesity are crucial. Achieving and maintaining a healthy weight is critical for preserving lung health and reducing the risk of respiratory diseases. Poor nutrition, the invisible threat to your lung health. Healthy eating habits are crucial not only for overall health but also for lung health. Proper nutrition provides essential nutrients to strengthen the immune system, reduce inflammation, and support tissue repair. However, poor dietary habits can negatively affect lung health and increase the risk of various respiratory diseases. Unhealthy eating habits are often associated with either inadequate nutrition or excessive calorie intake. Inadequate nutrition can result in the body not receiving the necessary nutrients, weakening the immune system, and adversely affecting lung health. Particularly, deficiencies in nutrients such as protein, antioxidants, omega-3 fatty acids, and vitamins can impair lung function and increase the risk of respiratory diseases. Excessive calorie intake can lead to obesity, which can exert pressure on the respiratory system. Obesity can cause the expansion of the chest cavity, compressing the lungs and making breathing difficult. Moreover, obesity can increase inflammation in the body, leading to lung inflammation and an increased risk of respiratory diseases. Unhealthy eating habits can also indirectly affect lung health. For example, the consumption of high-fat and high-sugar foods can increase inflammation, leading to lung inflammation. Additionally, an unhealthy diet can trigger metabolic syndromes such as obesity and diabetes, further increasing the risk of respiratory diseases. Adopting and maintaining a healthy eating habit is essential for preserving lung health. A balanced diet should include fresh fruits and vegetables, whole grains, protein sources, healthy fats, and an adequate amount of water. Furthermore, avoiding unhealthy foods such as fast food and processed foods and engaging in regular physical activity are important. In conclusion, poor nutrition can negatively impact lung health and increase the risk of respiratory diseases. Adopting and maintaining a healthy eating habit is crucial for preserving lung health and reducing the long-term risk of respiratory diseases. Not exercising regularly, an invisible threat to lung health. Regular exercise is a habit of vital importance for overall health and also has a significant impact on lung health. Exercise strengthens the lungs, supports respiratory muscles, and improves respiratory system functions. However, not exercising regularly can have adverse effects on lung health. Individuals who do not exercise regularly often have low lung capacities and may experience difficulty in opening airways and improving airflow. This condition can reduce the effectiveness of breathing and increase the risk of respiratory diseases. Moreover, not exercising regularly can impair the flexibility of airways and lung functions. Regular exercise promotes more efficient lung function and aids in opening airways. Aerobic exercises strengthen respiratory muscles, increase lung capacity, and improve lung functions. Additionally, regular exercise increases oxygen intake and accelerates metabolism, thus enhancing overall health and well-being. The effects of regular exercise on lung health are not limited to physical impacts alone. Exercise reduces stress, improves mood, and enhances overall quality of life. Reducing stress positively affects lung health and can decrease the risk of respiratory diseases. To best assess the effects of regular exercise on lung health, it is important to tailor your exercise program to personal factors such as age, gender, physical condition, and health history. Walking, running, swimming, cycling, and aerobic exercises are among the most suitable activities for regular exercise. In conclusion, regular exercise is a crucial factor that positively influences lung health. Exercise strengthens the lungs, improves respiratory system functions, and reduces the risk of respiratory diseases. Therefore, maintaining a healthy lifestyle and engaging in regular exercise are critically important for preserving lung health. The lungs, which are an important part of human health, can be affected by various internal and external factors. Factors such as smoking habits, air pollution, passive smoking, alcohol and drug use, chronic stress, obesity, and unhealthy eating can negatively affect lung health and increase the risk of various respiratory diseases. However, it is possible to take steps to protect lung health and prevent respiratory diseases. Quitting smoking, adopting a healthy lifestyle, regular exercise, healthy eating, and avoiding stress are effective ways to maintain lung health. Additionally, paying attention to environmental factors and avoiding exposure to harmful substances such as polluted air or cigarette smoke is also important. Protecting lung health is a way to improve our overall health and quality of life. Embracing a healthy lifestyle and taking care of our lungs reduces the risk of developing respiratory diseases and helps us lead longer, healthier lives. Let's remember that healthy lungs are the foundation of a healthier life. Give yourself and your loved ones the importance they need to protect your lung health and make healthy habits a part of your daily routine. Wishing you healthy breaths and healthy days throughout your life.